number's 21. So hi, I'm Abby. I'm going to be your student nurse today. Can you please state your name and date of birth?
Michelle Owens, 42270.
Good, it doesn't look like you have any allergies or you're a fall risk. So today I'm going to be doing a neurological assessment on you, and I just want you to know that everything is confidential, and I want to make sure you're comfortable. And if you have any questions through any part of the exam, just let me know, okay?
Okay, thank you.
Okay, so now I'm going to test your cranial nerve 1, which is your nose. So can you occlude one side of your nostril and blow? Like blow out. Okay, good, and do the other side. Good, now I'm going to check for your sense of smell. So I'm going to have you close your eyes and occlude one nostril. And tell me what this scent is.
Peppermint.
Peppermint, good.
Oh, I remember you.
Yeah, and then can you occlude the other nostril and tell me what this scent is?
Orange.
Good. So now so your cranial nerve 1 is intact. So now I'm gonna assess your cranial nerve 2, which is your optic. So if you want to take your glasses off for me. So I can set them right there. So now normally I would have you do the Selin chart test, which I'd have you stand 20 feet away, read on a chart on the wall, and like how you do at the doctor's. But we're in Emily's bedroom and we can't do that. And then I'd test your far vision with that, and then I'd do your near vision with the Jaeger-Rosenbaum test, where I would measure 14 inches out from your nose, have you cover one eye, read right to left, left to right, to test your near vision, but I can't do that. But I can, however, test your peripheral field. So I'm going to test your peripheral fields you're going to see my fingers wiggle out of the corners of your eyes, okay? So when you see them, I want you to tell me now, okay?
No. 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 No.
Okay, you have all 8 peripheral fields intact, and then also I would do the thalamuscope exam where I look in your eye, look for your retina and stuff like that, but since I don't have that, I can't do that. So from what I can tell, your cranial nerve 2 is intact, but obviously if we were in lab, it would be a little bit more thorough. So now I'm going to test your cranial nerves 3, 4, and 6 again. So just looking at your eyes, you don't have any ptosis, there's no rashes, lesions, no edema, no excess tearing or anything like that. So now I'm going to have you focus on the picture on the wall over there, and then I'm going to just shine my light into your eye, okay? But first I'm going to measure your pupils are about a 4 bilaterally. So can you just look over there and focus? Good. Good, your eyes constrict bilaterally. Your direct response is constriction, so it's your consensual response. So now I'm going to have you follow my pen light in, okay? Good. Your eyes accommodate to the convergence, which is good. So now I'm going to have you follow my pen light with your eyes. Good. You follow through all 6 areas of gaze. So like we did before, I'm going to have you focus on the picture, and then I'm going to just cover and uncover your eyes, okay? Good. Good. So your eyes remain fixed bilaterally. So from what I can assess, your cranial nerves 3, 4, and 6 are intact. So now your cranial nerve 5. Can you clench your jaw for me? I'm just going to feel. Good. Your masseter and your temporal muscles constrict. So now I'm going to do light and dull sensation. Well, first I'm going to do the cotton ball. So here, when you feel that on your face, I'm going to have you close your eyes, and I want you to tell me where you feel it and how, and tell me now that you feel it, okay?
Okay. Now.
Where do you feel it at?
Top left.
Okay, good.
Top right. Cheek right.
Mm-hmm.
Cheek left. Chin left. Chin right.
Good. So now I'm going to do the sharp and dull. So I'm going to have you hold out your palms, and then here's the sharp.
Ouch.
And then here's the dull.
Okay.
So I'm going to have you close your eyes, and I want you to tell me the difference between the two. So if you feel the sharp, tell me you feel the sharp.
Okay.
If you feel the dull, tell me you feel the dull.
Okay.
Okay. Okay, and tell me where you feel it again too.
Top soft.
Okay,
Hard. Top right.
okay.
Cheek hard. Hard cheek left. Soft chin right.
Yeah.
Soft chin left.
Good. And then this is when I'd also test your taste on your, actually no, this isn't. So your cranial nerve 5 is intact. So then now I'm going to test your cranial nerve 7. So we're going to do what we call facial gymnastics. Can you smile? Can you frown? Can you raise your eyebrows? Can you scrunch your forehead? Can you puff out your cheeks? Can you do duck lips? Okay, good. Now can you close your eyes again? And then just gonna, don't let me pull open your eyes.
Answer cold.
Sorry. So, and then this is when I'd also test your taste, but for the purposes of this, we don't do that. So your cranial nerve 7's intact. So now, they say to verbalize it, but I actually have gloves. So now I'm going to test your cranial nerves 9, 10, and 12 by looking into your mouth. If you want to put your glasses back on, you can. Just going to put some gloves on.
You didn't need a clean bathroom.
Actually, this isn't the part. I have to do your hearing test. So I forgot number 8. Okay, so now, since I don't have a tuning fork, this is what I'm going to use as my tuning fork. It's a toothbrush to stimulate the vibrations. Before I do that, I'm going to stand behind you and I'm going to have you cover your this ear, your right ear, and I'm going to whisper a word and I want you to tell me what it is. Popcorn.
Popcorn.
Okay, good. And now do the same with the other. I'm going to whisper a different word. Baseball.
Baseball.
Good. So now I'm going to do the Weber test, which I just want, normally I'd hit my tuning fork, you feel the vibration. I want you to be able to hear it in both ears. If you don't, that's kind of abnormal. So just tell me if you hear this in both ears.
Okay.
You hear the
Yeah, I do.
Okay.
I do.
So then after that, I would do the Renee test where I'd hit it, wait for it to stop, and you tell me when you hear it and when it stops. And then I do the same on the other, then I'd hear for air conduction in front. So I'm looking for air conduction being louder than bone conduction, but since I'm using a toothbrush, I just want you to be able to hear it, okay? Just gonna pull your hair back.
Yeah. I
You hear it?
Yes. Yes.
Okay.
Gives me the chills.
I'm sorry.
Yes. Yes, I hear it.
Okay, good. So now I'm going to do your cranial nerves. So your cranial nerve 8's intact. I don't know if I said your cranial nerve 7, that's intact too. But now I'm going to do 9, 10, and 12. So I'm just going to put my gloves on. It says to verbalize wearing gloves, but I'm going to actually do it since we have it because I don't want to put my fingers in your mouth without any protection.
That's good. These are clean gloves, right?
Yes, they're clean. Don't worry. Okay. So I'm going to take my pen light and first, can you swallow for me? Okay, good. You don't have any difficulty swallowing. So now I'm going to use my handy dandy tongue depressor here and I'm going to put it in. Can you say ah for me? Good. And then can you push against it? Okay. Okay. Good.
Oh, I'm sorry.
So, your soft palate and your uvula, they rise symmetrically bilaterally, and they move when you say ah, which is good. So now we're gonna test the range of motion of your tongue. So can you stick your tongue out? Can you move it side to side? Okay, now can you push it against your cheek and don't let me push it in? Good. Push against your other one. Good. So from what I could assess, your cranial nerves 9, 10, and 12 are intact. I'm gonna throw those away. So now I'm gonna do your cranial nerve 11, which is your spinal accessory. So can you shrug your shoulders? Good. Now shrug them again. Good. And then now can you turn your head to the right? Straight. Turn your head to the left? Straight. Good. So you have full range of motion of your shoulders with the resistance. You have full range of motion with your head, and so your cranial nerve 11 is intact. So now we're gonna assess the way you walk. So if you want to stand up for me. Oh, actually, can we sit back down because I forgot one thing? No, I didn't. Never mind. Sorry.
That's all right.
So, can you walk like this for me? Good. And now going back, can we tandem? Can you walk like this? Good. Now can you walk on your heels like a duck? And then can you walk on your toes for me?
Without limping.
Good. So you walk with opposite arm strength steady. You don't lose your balance when you tandem walk, which is good. And you can walk on your toes and your heels with little to no difficulty. So now I'm going to have you, I'm going to do a Romberg's test on you. So I'm going to have you stand right here. And can you, okay, I'll go over here. Can you stand straight looking forward for 20 seconds? I'm going to time you. Good. Now if you want to do the same thing, close your eyes. Don't worry if you get dizzy. I'm here to catch you. Good. You have a negative Romberg's test. So now while you're up, can you hop on one foot like this? Good. She has two torn meniscuses, so this is a little difficult. So then, can you do it on the other one? Okay. You could do it without really losing that much balance with the circumstances.
Yeah.
So now we're gonna test. Can you touch your nose 3 times like this for me? Okay, good. Now can you do that with your eyes closed? Good. Okay, so you can do that smoothly with no difficulty. So if you want to sit back down again. Okay. So now we're gonna test your finger speed, like I like to call it. So can you touch your fingers to your thumb and rapidly get faster? Good. You can do that with no difficulty with rapidly getting faster. So now I'm gonna have you do that same thing with your thighs. Can you go get faster? Good. You can do that with little to no difficulty. So now, I think, let me just gather my thoughts real quick. So now I'm going to do the sensory on you. So, like we did before, the light touch and stuff like that. So I'm going to touch all of your body this time, okay? So I'm going to have you close your eyes and again here, every time you feel the cotton ball touch you, can you tell me now?
Okay. Now.
Sorry.
Sorry. No.
Okay, good. Now I'm going to do your lower extremities, and I'll do your abdomen all together.
Okay.
So close your eyes.
Okay.
Okay?
Oh, sorry. No.
Good. So now I'm going to do the sharp and dull, just like we did before. You need to feel them again?
No, I know.
Okay. So I'm going to have you close your eyes and tell me the difference between the two, okay?
Hard. Soft. Hard. Soft. Hard. Soft.
Okay, I'm going to do that on your back.
Okay, sorry. Hard.
Did it tickle?
Yeah, it tickled, sorry.
Okay, I'm going to do it again over here.
Okay. Hard. Or soft, I'm sorry. Soft.
Okay, now I'm going to do it on your lower extremities. Can you close your eyes again?
No, sorry. Hard.
Okay, good. Now I'm just gonna have you lay back and I'm gonna do the same thing on your abdomen. Yeah, I can cover your legs.
I need a warm blanket.
Okay, so tell me, can you tell me what this is?
Soft. 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 Soft.
Good, and now.
Hard. Hard.
Good. So you can sit back up for me. So from that, you can tell the difference between light, sharp, and dull sensory, which is good. So now I am going to have you close your eyes
Okay.
and close your eyes and then put your palms out and tell me what this is.
That's a hair tie.
Okay, good. And now we're going to do the same with the other hand.
Oh, sorry. A coin.
Okay, good. And now I'm going to draw a number on your hand with your eyes closed and tell me what number this is.
Oh, 1.
Okay,
An 8.
good. So now, what?
It tickled.
It tickled. Okay, you can open up your eyes. So now I'm going to point to certain areas on you. So you can keep your eyes open for this, but when I point, I want you to point and tell me where it is. Like, you also point and be like, this is my arm, okay?
Okay.
You can keep your eyes open.
That's my shoulder. That's my shoulder. That's my elbow.
Yep.
Elbow. Left elbow. Wrist.
Yep.
Wrist.
Okay.
Chest. Chest.
Well, I guess you can't point to your back, but I'm going to do it on your lower extremities.
I can't reach
Yeah.
my foot because
Okay, good.
ankle.
So now, first, sorry, let me think. Okay, good. So now we're going to do your reflexes. So if you can just dangle your arm for me, and I'm going to try to test your tricep. This is my alternative tuning fork, or reflex hammer. Good. Good. And now I'm going to do your brachial. Just going to rest it right there. This one's a little hard to get sometimes. Good. Good. And now can you just hold your wrist out like this for me? And just turn it to the side a little bit, like this. Just good. Good. And now I'm going to do your patellar. Good.
Anticipation.
Good, and now I'm going to do your Achilles. Good. Good. So, all your reflexes are about a +2. I mean, it's kind of hard to stimulate them with a hairbrush, but overall, good. So now if you're going to lay back, I'm going to test your plantar reflexes.
Oh,
This is, yeah, so I'm just looking for the dorsiflexion of the foot. This probably is going to tickle.
Yeah, it tickles.
Good.
Yep.
Good. And now I'm going to do your abdominal reflexes. If you can lift up your shirt for me just a little bit. It might be hard because you did have kids, so your abdominal muscles are a little...
Kids, yeah.
Yeah. She had twins, so they're... Good. Good. Just going to pull down a little bit. Good. Good, your umbilicus does deviate inward, which is good. Now, if you're a boy, I would test your comastric reflex, which it tests your scrotum, but you're not a boy, and we don't do that in health assessment anyway. So, I'm going to do the Basinski's test on you, but just your Glasgow coma score, you're alert and oriented, you have spontaneous eye opening and closing, and you have not obeyed, but you've done everything I've said without any issues, which is good. So now the Basinski's test, I'm just going to raise your head a little bit. Just,
Oh, sorry.
now I'm gonna raise your head up a little bit. Good. So you have a negative proficiency test, which if it was positive, your legs would be flailing because that would hurt because I'm testing for meningitis.
Oh.
So now I'm gonna flex your knee, and then I'm gonna straighten it. Do you have any unnormal pain or tenderness?
No.
Okay, good. Gonna flex this knee. Do you have any pain or tenderness?
No.
Good. So you're negative for meningitis as from those tests. You can sit back up, and I'll just cover you. Now, do you have any questions for me? Because that's the end of my exam.
No, thank you.
No. Okay, it was very nice. Thank you for being my patient. You can stop it.